Hello, hi. I'm here with Barely Bear. I wonder if you'll stay with me. Maybe you can make it. You okay? Barely Bear came with me to the doctor's today. It's December 17th. It looks like our last update was November 15th. So as usual, I'm just going to look at the calendar to see what I missed and what's coming up. Looks like maybe I don't remember why I did a appointment on 11:15. I must have had a doctor's appointment just before then. I just don't see it at the moment, but that's okay. So I gave my blood on the 26th for the ctDNA scan. I'm not up to date on those. I should have them all charted out, but I haven't done that. I got my PET scan on the 3rd of December. Yeah, so that had been pushed up because of insurance denied it. That went fine. I enjoy the people there. And Barely Bear and I went that day, and I promised Barely Bear I'd try and bring him to see a Rothko. And I got to the museum and they wouldn't let him in, so he had to stay in the locker. So I told him all about it, which was bittersweet. Um, and that brings us, does that already bring us till today? Yeah, or well, yesterday on the 16th. Somehow we're already there. Did I somehow miss anything? No, I don't think so. So yesterday I saw the oncologist. That's the 16th of December. So she said that this is interesting, odd. So she said we still didn't see anything on the PET scan. So to review, the ctDNA seemed to show a recurrence, but the PET scan doesn't show anything on imaging, so there's no target. So who knows where the recurrence is, right? Or if there is a recurrence, I suppose. And so there's no real treatment plan, and we don't know if that treatment plan, if it's metastatic or diffuse in the system, it would probably be chemo, is what she said. And if it's, I think she said very localized, then like radiation or surgery or both would be among the possibilities. So I asked her. So she said my last ctDNA had gone back down. So it had been going up, I think like three, I think is the number. I wish I had that for you. I think it was going up from zero, NED, going up, and then I think it went down, but not all the way down. So I asked her, okay, so what does that mean? Or what might it mean? In my estimation, if it goes up more than once and it trends, and it did it, I think three times, could have been four. That doesn't seem to me like it's an error in the testing. But on the other hand, why would it go down? That seemed like a real surprise to me. And she literally shrugged her shoulders and she said, I think we have to assume it's the testing. Now, that could mean that, it could mean that this is correct for the testing, and the one that was a little bit less is the one she said, let's assume that's the testing, like in terms of within the plus or minus of the test. That could have been what it is. So I've scheduled my next test, and I'll tell you it's like next week or something. And so she said one thing that we do see is in the area of the scarring on the lungs from the radiation treatment that I had. She said those, I can't remember how she described it, but essentially they may be getting bigger. There may be changes. Right? In other words, that's a point of concern, but we don't know. And it could just be the scarring, and it could just be how we saw the scarring this time. So she wants me to talk to the radiation oncologist, which I haven't made that appointment yet. I just checked right before I talked to you to see if I had gotten a message. And she gave me a choice because my radiation oncologist has left and is in another place, but I could visit her there. And I opted to meet whoever I can meet where I'm used to going. But I was very happy with the oncologist I had, so there's no reason to look for another doctor apart from I'd rather stay in the place I'm in. But I don't feel strongly about it. I'll go wherever it makes the most sense. So, that seems like, that could possibly be um, a reason to suspect that it's back in the lungs. I asked her about it. She said it doesn't seem very likely that they want to do radiation again in the same place. Um, so she thought it's more likely that if it's returning in the lungs, it would be a surgical candidate, even though last time my understanding is that it could have been surgery and it could have been radiation. We or I opted for radiation. But I guess my understanding is that if they return to the site, they'd rather do surgery. I don't know if that means because they think, oh, the radiation doesn't work, or that's too much cumulative radiation scarring or damage or risk. So I'm not quite sure. So I guess I'm supposed to talk to somebody about surgery or surgical oncology regarding the lungs, I think. But I don't have that person's name or the appointment, so I'm not quite sure how that happens. I assume they reach out to me. And this was just yesterday, so I don't know. I also told her about an issue I've been having that really has been feeling for some months, just like this initial problem happened when I first noted um, a change in sensation in the abdomen, and I've been having a similar thing off to my left side, maybe by the crest of the hip, maybe near the kidney, kind of intermittent. It's indistinct. So I brought it to her attention. I thought she'd maybe examine me, and she didn't. She was like, "We're gonna get you in to get a colonoscopy. That's it, like just straightforward." And I was like, "Great, whatever you think is the best." I know I'm being scanned a lot, and so I don't know that we'd be missing anything. So I made an appointment with Dr. Dorfman for that in February, I think, and I'll come back to that in a moment. So that was yesterday. Okay, so today I went in for my fourth consultation with Dr. Duffy about repairing the hernia. And maybe you'll remember, but that hernia is, basically from the pubic bone up to the sternum, and then also where they did the put the hole in me to get the colon out. So basically, I have herniations all the way up here and especially over here. So I went to see Dr. Duffy for the fourth time, and he said, all things considered, looking at where we are with the cancer journey and my other sort of vitals and blood work and the fact that I had just been in the hospital for the second time of a partially obstructed colon. He said, let's do surgery. We discussed the options such as repair the worst of it, the problematic part, and obviously at some point do the other ones, or just do it all at once. I asked him some interesting questions about it. He was very educational. We both came down on the idea that do the whole thing at once is probably our best option. He did explain that if they have to return to the site for like another surgery, let's say cancer, they can go through the hernia repair mesh, let's call it, and close it back up. And sometimes they can go around it too. So he said it wasn't like a really big concern. He's the first time in my entire cancer journey he was talking about the cancer, and he said it's curable. Nobody's ever used that word with me before. But he also said the surgery I want to do, there's a 1 in 200 chance of dying. So in the same like paragraph, I guess, he's the only person that ever said curing, and he's the only person that ever said there's a chance of dying from this. Although that's obviously all in the paperwork, everything you sign. So I thought that was interesting. Let's see. Okay, so that's sometime in February. So February 5th is when I go in. It's interesting, when I first saw him, I remember it was February 14th. You'd be surprised to remember to guess that I remember that date. But anyway, February 5th is when I go in. My understanding is it's likely to be called an outpatient surgery, but I will be in the hospital for 3 to 5 days. That's what he told me. He said, I forgot, I wrote it down, but I think he said 2 to 3. He said, I'll be on a lifting weight restriction, and 2 to 3 weeks before most people return to work after that surgery. But, you'd be walking the next day. So, in my mind, that means once I'm back from the hospital, I'm teaching, but, seated or leaning or standing or maybe on the weak side. So I guess way in advance, I'll have to just seek your flexibility, generosity, patience, and we'll just see how we can go through this as we get closer. I'll map out how my schedule has to change. I don't really know exactly. It looks like I have to teach a wellness day like a week later. So who knows? I just see that on the schedule now. Well, we will just have to see. um, Let's see. So the colonoscopy was scheduled, or the visit with the colonoscopy doctor, I don't think it was a colonoscopy, was scheduled for February 11th. That's basically a week later. But I didn't, I messaged him to say, hey, just so you're looped in on this whole thing, I assume we rescheduled. I don't really know, but I assume that'll change. But that's, I think, the next thing I know. I haven't really thought through what that means for any other plans I've been trying to do in terms of travel or workshops or anything. I just don't really know. But I suppose I'll just come home and recover as best I can. And I don't know. I think that's all I know. I have to teach in a few minutes. So anyway, this should be the second giant big surgery I've ever had. So I've been working towards being as ready as I can, and this looks like it's what's up next. Obviously, this could change because I'm going to get ctDNA again soon. I think I have a PET scan before that too. I can't remember, but anything could change, particularly if, again, I have to go in on an emergency basis for another obstruction. So that's what I know so far, and now you know. And Barely Bear's getting a little tired, huh? Yeah, this is an awful lot. In terms of insurance, my insurance, for political reasons, ends at the very last day of this year. I have no idea if I have insurance for next year, so that's a whole other problem. Like, maybe I can't do the surgery, and even though I'm talking about planning it. I paid the premium for January and they accepted it, but they didn't say, well, here's your new insurance card or your new insurance number or group number or any of that stuff. There was nobody that would answer phone, nobody that would reply to a chat request, no email help, login challenges on like 4 different insurance websites that you had to go through. So I really just don't know where I'm at. I paid them. Like, that sounds like probably I do. I don't know how good it is or what it's going to do. Most of my stuff's in collections from the other surgeries anyway, in hospital visit. But anyway, I made the appointment. We'll just see what happens. And maybe you'll find out what happens too. Okay. Love. Thanks.